We're discussing one of my favorite topics again today, and that is botulinum toxin. We've talked a little bit about it in the past regarding how you go about receiving the treatment, whether it's painful, how long it lasts, and today we're going to extend a little further into other medical indications. To start, a quick recap on what you can expect. You come into the practice, we apply an anesthetic cream to the area we're targeting. Wait a little while, the area becomes numb, and then we inject into the target muscles. It takes about 2 weeks before you get the full effect of the botulinum toxin. What we're really enjoying seeing at the practice is we're getting almost equally as many male patients coming through as females for botulinum toxin. And I think they're happy to see that you can get a very natural look. So many patients were concerned that with the injection of Botox, you may look a little frozen or artificial, but it can be injected appropriately, so you soften muscle movement instead of paralyzing it entirely. There are so many medical indications for botulinum toxin. I'll be discussing some that we've used the toxin for in the last week, really. A common condition is rosacea, and rosacea as well as flushing. And here it can really assist with the redness you experience with both these conditions. Further, we use for something called hyperhidrosis, and this is a condition where the sweat glands start to produce perspiration excessively. We may also use for certain conditions where you have neuromuscular disorders, for example, a tic with repetitive motion. Toxin here can soften the muscle contraction. Finally, the fine print. Botulinum toxin is usually used for fine lines or wrinkles. Commonly injected areas include the forehead muscles or frontalis, the corrugators or brow muscles, as well as the area just lateral to the eye where you get your laugh lines. Further though, you can inject the neck area, especially in those with a longer neck where you start to experience these necklace lines coming along. And that muscle that we inject in the neck area is called the platysma. The platysma is also responsible for a little bit of wrinkling you get along your upper chest area, and injection along the upper chest area can also lead to a softening and an anti-aging approach along here. We've been getting a lot of positive feedback from our patients at their 2-week reviews, and I thought I'd share with you what I hear most consistently, and that is when they look in the mirror, they're feeling more refreshed, like themselves, but refreshed. They feel calmer, they look calmer. Mostly, they're